due to the effect of gravity, you have a relative overperfusion, and in addition, the blood in the lower lobes would need to travel a greater distance from the center to the periphery, just like a congested road where the traffic is terrible. There is a longer time that blood would reach the periphery. So, for example, when you have uh, pathologies in which the pathology travels within the blood, just like hematogenous spread or immune complexes, which is the reason for development of idiopathic interstitial pneumonia or septic emboli. These pathologies would develop with a lower lung predominance. It's also not surprising that hydrostatic pulmonary edema would be lower lung predominant. Other diseases such as the aspiration pneumonia could be explained by a more vertical course of the right mainstem bronchus in the upright patient and hence would develop in the more dependent regions. Now, what about asbestosis? When you think about the pathology of asbestosis, you might think or initially expect that this would be clumped together with the other pathologies which are inhalational, such as silicosis. The definite reason for the development of asbestosis-related diseases with the lower lung zone predominance is unknown. However, a suggested reason may be due to the needle shape of the asbestosis fibers, which likes to develop or lodge, which likes to lodge at the lower lung zones. So that's it. So let's now go back to the images I shown to you earlier. For the first question, we noticed that looking at these choices, one is an odd man out. TB and silicosis are both inhalational mechanism. Sarcoidosis is similar to TB, which is a granulomatous disease, favoring the upper lobes because of decreased lymphatic clearance. So the answer is D, because for aspiration, because of the effect of gravity, the opacities would more likely develop in the dependent regions and in their lower lobes. So the answer is D. For the second question, the odd man out is letter C. The mechanism of A, B, and D are all inhalational. For hypersensitivity pneumonitis, you inhale the antigen in the air. The smoke inhalational injury, smoke from the air, and berylosis, also an occupational inhalational mechanism. C is an interstitial lung disease, and the presumed cause is deposition of immune complexes, and these immune complexes would travel in the blood. And since they travel in the blood, they're expected to go primarily at an area with greater perfusion, and because of gravity, it's the lower lobes. So if I were to give a representative image to show an idiopathic interstitial pneumonia, I would be giving a lower lobe image. And third, we have a pathology here that involves the lower lobes, and among the choices, one is inhalational in mechanism, and that is silicosis. If one was to give a representative image for silicosis, more likely a slice through the upper lobes would be more likely to be given. That's it. Thank you very much for listening.